Welcome, everyone. We'll be getting started in just a moment.
My BFF.
Yeah,
How's everybody doing? This is Trent. And
wait, should I turn my camera on?
Would help.
If you all can mute yourselves, that will be helpful. Thank you. Okay, we'll go ahead and get started. Thank you so much for joining us. My name is Kim Irwin. I serve as the administrator of the Indiana Public Health Association. We are today and tomorrow celebrating an IPHA conference and annual meeting. So 2 full days of program activity and speakers, national and state level speakers covering a variety of content. So with that, the timing was such, given all of the things happening around at the State House and with Senate Bill 5, that we wanted to take this opportunity to have a media briefing, share the concerns that we as public health professionals have around Senate Bill 5, and provide some information and give you an opportunity to ask questions. So we're thrilled to be joined from media from around the state. We've had a lot of outreach this morning in different media markets asking for input and interview requests and that. So thank you to all of you. And we also have a number of public health friends and stakeholders with us as well. So thank you very much. We will ask that you remain muted throughout the remarks. We will be happy to take questions beginning right around 12:15, 12:20, we hope, and then we can do that for 10 or 15 minutes. Please do make use of the chat for questions that you may have or issues you want to raise, that kind of thing, and we'll address those as we get to the end. And also when we get to Q&A, if you do want to raise a hand or that kind of thing, assuming we see it, that will be just fine. So with that, we are joined by 4 primary speakers today. Susan Jo Thomas, who is the current president of the Indiana Public Health Association. Dr. Jeremy Adler, who represents Tippecanoe County Health Department and is the president of the Indiana Association for County and City Health Officials. We've got Dr. David Welsh, who is a health officer in Ripley County, Indiana, and also involved very closely in the Indiana State Medical Association and the American Medical Association. And then Dean Paul Halverson, who's the founding dean and professor at the Indiana University Richard M. Fairbanks School of Public Health. So my appreciation to each of you for taking time out of your very, very busy schedules to do this today. And with that, I will turn it over to Susan Jo.
Good morning. I am very happy and honored to be the outgoing president of the Indiana Public Health Association. In an hour from now, we will have had our annual meeting and there will be an election for the new IPHA president to take over. I have been the president for the past 2 years because, as we know, COVID has changed everything and we weren't able to meet last year as a conference. I wanted to give you just a little history of IPHA. We've been around for a long time. 1947 is when we were founded, and we are the state affiliate of the American Public Health Association. Our role and our journey is to be the partner, the connector, the resource for our members and stakeholders, all of those that have interest in public health and health equity in the state of Indiana. That's my introduction. I'll now go to Dr. Adler.
Thank you, Susan Jo. Good afternoon. It is my pleasure to be here with you today, representing INSACHO, the Indiana State Association of County and City Health Officials. INSACHO is comprised of local health officers, local health department administrators and staff, members of local boards of health, faculty from our schools of public health, and other individuals associated with public health throughout the state of Indiana. INSACHO's mission is to promote, protect, and improve the health of Indiana's citizens by advocating for sound public health policy, organizing professional workforce development training, and facilitating networking among the public health community. If we could go to the next slide, please. Indiana Senate Bill 5. This is why we are here today. Indiana Senate Bill 5 would be a dangerous experiment that Hoosiers would soon regret. Senate Bill 5 was written as a direct response to actions taken by local health departments during the COVID-19 pandemic to prevent the spread of disease and save lives. However, this bill would have a far-reaching and profound impact on many of the other duties and responsibilities of local health departments. Without a doubt, Senate Bill 5 will negatively affect the ability of local health departments to protect their communities. If Senate Bill 5 were to become law, Hoosiers should expect dangerous consequences on several fronts. First, the bill gives elected officials full control over major public health decisions, most of whom lack the expertise needed to properly engage in unusually complex public health subjects and regulatory matters. These elected officials would now be responsible for restaurants experiencing outbreaks of E. coli, norovirus, and hepatitis A. They would also be responsible for Legionella in hospital settings, lead in our drinking water, and deadly bacteria in our swimming pools. Another major concern of the bill is shifting the local health enforcement appeals process from the courts to city and local county boards. This would require significant additional infrastructure on the city and county level, and would also add another cumbersome layer for public health officials to navigate. Even worse, until an appeal is heard by a city or county board, the entity in question would have an opportunity to remain open, even if it is not following health orders. With a process lasting potentially weeks or months, this provision alone could lead to catastrophic disease within a community. Another concerning element of the bill prevents a local health department from implementing orders that are more restrictive than those issued by the governor, unless such orders are approved by a local legislative body. As you can see, Senate Bill 5 would be bad news for all Hoosiers.
Good afternoon. I wanted to add on to Dr. Adler's comments. I wanted to assure the public that local public health officials take very seriously their role to protect the public health, as well as make sure that the economic impact is minimized and personal freedoms are maintained. I can tell you in my own county that we've been successful because all the stakeholders have been working together. Schools have been open, not because they were just open, but they were open and following good guidelines. Elected officials have been involved from the get-go, so I don't think what's included in Senate Bill 5 will add to that. We need to just communicate with our stakeholders in the area. I know this is a very emotional charged issue, and I understand that, but it's a public health issue, and we take our responsibility as health officers and members of the health community very, very seriously. And at the same time, we have to deal with a number of other issues. So just because we're dealing with a pandemic doesn't mean that other things are not out there, like water safety, sewage safety, food safety. We want to make sure that when you go out to eat, that you're getting done in a safe manner. We're coming on the summers. We need to look at pool safety. So we're not just dealing with the pandemic. We want to make sure that businesses, schools, and other entities are open, but open safely. So Senate Bill 5 in its current state would add increased layers of government to what's already out there. And it also, public health is something a lot of folks aren't familiar with until it touches them, until somebody in their family gets sick. But a lot of times when the public health officials have to act,